Hi, my name is Dr. Anthony Virella. I am the founder of Virella Neurosurgery, one of the leading minimally invasive spine surgery practices in Southern California. I did my medical school training at Columbia University in New York. I then did an internship in general surgery at the University of Pennsylvania and my residency in neurological surgery at UCLA. I then went on to the Cleveland Clinic Foundation to work in the field of complex and minimally invasive spine surgery. I chose these institutions because it allowed me to work with the leaders in the field of minimally invasive spine surgery and to be involved in many of the original research projects and pioneering developments that eventually led to the birth of this very exciting field. When I completed my residency training in 2004, I searched many different practices in Southern California, which I might join, and what I quickly realized is that none of the established practices were providing patients the minimally invasive approaches that I had learned in fellowship. So with that in mind, in 2010, I decided to open Virella Neurosurgery in an effort to provide these cutting-edge, minimally invasive techniques to the residents of Southern California. Over the past 2 decades, I've devoted my life to pioneering and researching and keeping abreast of the minimally invasive techniques that are out in the community. My research has allowed me to continue to modify and develop these techniques in order to bring these very critical techniques to my patients. Many of my patients come to me scared, depressed, they're in pain, because quite frankly, it's quite frightening to go see a spine surgeon because the automatic thing will be he's going to recommend surgery. But based on what I've seen over the past several years, the field of minimally invasive spine surgery has evolved tremendously. In 2014, we are able to essentially perform the same surgery that we were able to perform 10 years ago with a small 1 centimeter incision. We're able to get these patients out of the hospital, usually the same day. We're able to get patients back to work in many instances the next day, and we're able to essentially get patients back to their normal activities as soon as possible, and that's our goal at Virella Neurosurgery. I operate on approximately 10 to 20% of my patients. We are a comprehensive spine practice. A lot of our treatments are not surgical. They are essentially non-surgical conservative treatments, and our office is very proactive in coordinating these treatments. Some of them include physical therapy and epidural injections. Sometimes observation is all that's needed. But our goal is to treat you, the patient, with the least invasive procedures possible. And many times that's not a surgical procedure. Many times that is just coordinating conservative care. So there's no need to be in pain. There's really help, and it's available. And I encourage everybody to give us a call and get acquainted with Virella Neurosurgery. Many of my patients have come to me years after their procedure, thanking me because they were able to get back to their life sooner. They were able to get out of pain and get back to work and get back to the things that they enjoy doing. And as a physician and surgeon, that makes me extremely happy that I'm able to use my knowledge and my research to help my patients get back to life.